If I did not fail my surgery rotation, I would be officially a fourth-year medical student today.
Cyclothymic disorder is a chronic mood disturbance characterized by greater than or equal to 2 years of numerous periods of hypomania. Okay. So BP1 is manic with or without depressive episodes. And 2, mood instability that's typically reactive to interpersonal stressors. All right. All right, which of the following is most likely diagnoses? A 28-year-old woman is brought to the office by her husband who is concerned about her recent behavior. For the past 6 months, she's refused to eat any food that is not prepared out of fear of becoming ill. All right, some paranoia. The patient worries that the rash will spread to other areas and fears she is developing a slowly progressive illness. All right, patient's mood is anxious and affect is tense. I mean, I feel like she's paranoid. So schizotypal, no. Schizophrenia, no. Paranoid personality disorder, C. It's been going on for the past 6 months, but sometimes personality disorder is something someone's had forever. It doesn't just like pop up one day. Obsessive compulsive disorder. I mean, she does have this obsession. Illness, anxiety disorder, or delusional. So I don't think it's delusional. Illness, anxiety is when I stay getting that and somatic symptom disorder mixed up. So somatic symptom is when you keep going to the doctor because you think something is wrong, you want them to find it. Illness, anxiety is also you're like fixated on something, I think. Ooh, clearly need to go for that. I don't know. So I just thought this was paranoia, but it's not personality disorder. Okay, let's go with illness, anxiety. Dang it, and it was delusional? Fudge. Oh, so hers is persecutory with being poisoned, harassed, plotted against. Okay, so illness, anxiety, experience anxiety with excessive concern and preoccupation about having a serious medical illness. So it's literally a medical illness. And I'm pretty sure I said that and then still chose this because she don't think she had a medical illness. She thinks somebody poisoned her. Oh, girl, you need to go with what you said. The average was a 61 and I got a 58. So let's see, what's the section that I need the most assistance on because it's not... On my way to the exam, y'all. Feeling pretty good. Stay tuned. Let's see how we do. It's cold. It's raining. Y'all done got this umbrella from Lost and Found because I left mine at home. But, ooh, it's literally like raining. I don't think that exam was too bad. And I actually finished with like an hour and a half left. And let me put this up higher, y'all. This positioning is weird with this rain and this umbrella. But I finished with like an hour and a half left, but then I did the unthinkable. I went over all of the everything, but I did skip like 4 or 5 questions, had marked 9, and then I went over them all. But overall I feel pretty good. The biggest part that was difficult was the medications, but. All right, y'all, let's talk about the exam. I am officially done with psychiatry. And I don't say that being like super excited or anything because I actually genuinely enjoyed the rotation. Am I a future psychiatrist? I don't know. I mean, I'm not, but I really, really liked it. And I now understand why people go into the field. Either way, let's talk all things exam fillings, topics you should know when studying for it, and how if I did not fail my surgery rotation, I would be officially a 4th-year medical student today. Moment of silence. It's all right. This is my story. This is my journey. And I'll be a 4th year in 8 weeks once I take the surgery shelf exam. Literally exactly in 8 weeks. Oh, and we could get into what my specialties are going to be on surgery. Got that email yesterday. And I'm just like, all right, we're doing it. Let's go. So I need some chapstick. All right, brief tidbit.
Y'all, I've been on Accutane for, isotretinoin is the generic name, for, I think I just started my 6th month. Look at my skin, y'all. I'm glowing. I am really glowing. My lips are really, really dry all the freaking time, but my skin is doing this big one. Anyway, I didn't have any anxiety leading up to this exam. Literally stopped studying yesterday around 7, which honestly sounds pretty late, but I had therapy and I had like mental health therapy and physical therapy yesterday. So that took away some time that I should have been studying. I was also taking my hair down, as y'all saw earlier. And that took forever. I would never do those braids that small again because I was like, bruh, we don't have time for that. So I just wanted to like finish all of my UWorld incorrects, which I did. And then I redid one of the very first practice exams that I did like maybe 3 weeks ago. And I think I got like a 50 something on it the first time. And yesterday, I think I got like a 74 or a 76%. So I was like, all right, like my last 3 exams are all in the 70s, which is passing. So I was like, all right, cool. I was like, wow, am I really just this prepared? Is this why I have no anxiety? Like, what's going on? Then I had a little bit of anxiety this morning and I forgot to take my metoprolol, which is for anxiety. I used to take propranolol, but it wasn't really working for me. It was propranolol 10 milligrams. And so we moved up to metoprolol 25 milligrams. I thought about it and I forgot about it and then I didn't take it. And I was on the phone with my father when I was talking to public transportation. He was like, did you take your medicine? And I was like, yeah, I took it because it's on my kitchen counter. After I eat breakfast, I take the meds. I was like, but I forgot to take my anxiety medicine. Why'd you forget to take it? And I was like, that one doesn't sit on my counter because I only take it exam days. I was like, but I'll be fine. Like, I'm not really anxious. So by the time I got to school, I wasn't anxious. I took out my iPad when I was commuting, which I typically do not do, but wanted to leave on an earlier transit, hadn't packed my lunch, could have left on an earlier one, didn't eat my lunch until I got home, couldn't see the future. It's fine. But I will say, I think having gone through all of the core rotations, albeit I'm repeating surgery, but I've been through it, right? So having gone through 7 rotations, y'all, the order of which I took them, family medicine, obstetrics and gynecology, pediatrics, internal medicine, surgery, neurology, psychiatry, I will say, just because you hear this overarching specialty, do not think that you won't see medicine. Like, I originally thought like, okay, on neurology, it's only gonna be brain stuff. It's only gonna be about seizures. It's only gonna be like multiple sclerosis or Guillain-Barré or, you know, things with the dorsal column tract or spinal thalamic, spinal cerebellar. No, you'll always have medicine because these are humans. These are real people's lives, and real people have other things going on. They're gonna have hypertension, gonna have diabetes. You have to know your imaging, have to know your medications and the management for it. For example, although it's a psychiatry exam, let me see, what are some medicine questions that came up on my practice exams? Of course, now I can't think of nothing. Like, why does that always happen to me? But even saying that somebody has multiple sclerosis, that has nothing to do with being a mental health, right? That's neurology, but you need to know what does it look like when you see multiple sclerosis. That will be T2 flare, and I believe it's like white foci on the MRI imaging, or like MRI or whatever, because that's magnetic resonance imaging, and I hate saying like magnetic resonance imaging, whatever. Sorry, personal problem. But I had to know what that was. You also have to know, like, it's typically a young woman, 20s or 30s, where the vision is gonna go in and out, and that's MS, period. That's not a psych question at all. Or this is something that's come up in multiple rotations, knowing drug toxicity and withdrawal. What does it look like if you have overdosed on alcohol? Or if you're withdrawing from alcohol, overdose on cocaine, or withdrawing from cocaine, benzos, marijuana, LSD, PCP. And I remember learning this in my block 6 of, what was that, like brain and behavior for M2 year back in the fall of 2022. I'm like, y'all, I am so green. I don't know these drugs. Like, I remember someone saying, oh, this quiz is gonna be easy because I've tried all of these. And I was like, you know, I'm not here to cast judgment or anything, but I have not. And for those reasons, I'm pretty sure I didn't do too well on the quiz either, because I was like, bruh, it's gonna take a little bit more studying for me to get through this because I'm just so unfamiliar with it. But knowing, you know, drug toxicities and withdrawal, I think yesterday I made a running list of, I cannot even see because I don't have my glasses on. Oh, all the things that are trauma induced. Acute stress disorder, which if that lasts from 3 days to a month, and if it's longer than a month, then that's post-traumatic stress disorder. So acute stress disorder can lead to PTSD. You can also have reactive detachment disorder. If a child has been like abandoned by a parent and now their behavior is acting out, that's why. Reactive detachment disorder due to like the trauma of being abandoned. Borderline personality disorder also comes from like trauma in the childhood, and their mood is very, very flat and likely suicidal. What else I have up there? Brief psychotic disorder and somatic symptom disorder. And then like just knowing all of what things that you're gonna need an SSRI for. Oh, that just reminded me to look up one of these medications from that exam. Which is serum serotonin reuptake inhibitors, typically used for depression. You can also use it for bulimia or binge eating disorder. It is also used, I believe you can use it for panic disorder. There's several things, right, that it can be used for. All in all, I just feel like what makes psychiatry tricky is the fact that it dips and dibbles and dabbles, is that the phrase? With so many other things. Like I had PEDS questions on that exam, and I was like, PEDS? I was at the VA. I didn't see no kids. Like, what do you mean PEDS? I took PEDS this time, like literally a year ago, I took my pediatrics exam. So I was like, okay. And I want to say it was probably like a handful of PEDS questions, a few questions with like pregnant patients, and I'm like, all right, I haven't seen that since the beginning of the rotation when I was learning things like postpartum blues, postpartum depression, or postpartum, OCD. I'm like, okay, what were the timeline again? And I feel like postpartum blues is up to 10 days after you deliver. It's either 10 to 14 days. Obviously, I can't remember the question anyway. And I wouldn't be able to say it also. It's like a whole agreement on the exam when you take it, like you can't repeat things. But the exam is 110 questions. I get time and a half, so I take it, I think it was like 4 hours and 7 minutes, something, give or take that amount. It's the earliest I've ever finished an exam. I finished with an hour and a half left. I marked 9 questions, skipped 5 questions, and then I did the unthinkable and went back and looked over every single question. I know I'm not supposed to do that. And when I got to the point of trying to change something, I was like, girl, do you have a really good reason for changing this? Or are you changing it because you're doubting yourself? Because we prayed before that exam and we said, dear God, I want to have the confidence to know what I know is correct. And if I don't know it, use proper testing strategies to get to the correct answer. And do not, under any circumstance, just be out here all willy-nilly changing stuff. In Jesus' name I pray, amen. Like, so when I was going back through and I was like, girl, are you changing this because you're doubting yourself? Or are you changing this because now you are settled and you know that you chose the wrong answer? So there were like maybe 3, let's say max 5 questions where I was like, I don't know if what I knew was right, or I don't know. And since I didn't know, I couldn't change it. So I was like, bro, we're not doing this. Like, with each exam, I'm getting closer to step 2. Like, now I only have 3 exams left. Surgery, again, step 2, and emergency medicine, in that order. Like, after I'm done with surgery, like, once I start surgery next week, I actually have to, for real, hop back on the wagon of studying for step 2. Okay? So we're going to do that with some decency and some order. So, overall, though, the exam was chill, I would say. I mean, I don't have my results yet, so let me not say it was too chill. Let me not say it was easy. I, for the most part, have thought every exam was fair. I did think that I thought peds was a little tricky. And I thought surgery was hard. Failed surgery. Failed peds by 2 points, but then I retook it and I passed it. But surgery was legit, to me, the only exam that was hard. In the beginning, family, OB-GYN, and peds, and internal medicine, I hadn't retaken step 1 yet. So each exam, I was so nervous that if I failed, then I got to go back to study for step 1. I know that I learned best by doing, and yeah. And so I just felt like that was a lot of pressure, a lot of weight on me. But now I'm just like, I mean, we here now, and 3 exams from being done, got a sub-I to do, and got some career electives to do, and I also going to be a docs tutor to either M1s or M2s. They haven't told me which year yet, but like, we're doing our big one, y'all. Like, I just feel good. What the sweater say? I am the doctor, okay? It's me. That's going to be me. And like, for right now, we're just going to practice it, saying good, because it's me. I'm going to be the physician. And it always feels good to walk out of an exam not like beating yourself up and just being like, oh my gosh, I should have done this. Oh my gosh, I should have chose that. I genuinely don't even remember some questions. There were some farm things I was just like, what? I had to look up one drug, imipramine. That's a TCA. And I was like, oh. I still think that what I chose was right. Don't know what I chose, but I didn't choose that. And I know for TCAs, I don't think you should use them with elderly or with children. Well, elderly with whatever their medical history was. But all that to say, we doing good. Psych down. Surgery, 8 weeks of surgery, standing between me and my 4th year of medical school. And once I'm done with surgery, that'll be like June 20th, I think. And I will have exactly 6 months of 4th year because I'm done like not March, Lord Jesus, December 20th. Yeah, we bouncing out the door. So per surgery schedule, I will have 2 weeks of plastic surgery starting on that next week. Orientation is at 7 a.m. on Monday, but since I previously did the orientation, I don't have to do the lectures, which are like 10:30 to 1. And then there was a break. I was like, going 7 to 1 is wild. That's 6 hours. But that's also surgery because them surgeries be long and they just be expecting you to go. So plastics for 2 weeks, cardiothoracic surgery for 2 weeks, and I did that last time. And that was the last 2 weeks of my rotation. Then I end on gen surge. I'm just like, because from my experience, general surgery had the worst hours, but it is okay. Maybe it'd be great that I'll be ending on that and be closer to my exam and closer to me taking step 2, because the plan is to sit for step 2 like 3 weeks after I'm done with surgery, so that I have like a week break to just like breathe and live my life, but we'll see. And then what else? I really think that that's all the updates I have for now. We're gonna see if we could be consistent with putting out content weekly. Cause don't hold me to the day that I dropped them. It's supposed to be Mondays, or it was previously Wednesdays and it was Mondays, and I would do some Thursdays and Fridays. You know, I'm doing my best. I am doing my best. So just turn your notifications on so you don't miss a beat. Whenever the video drops, you get that notification and you come on over and you watch it with us in the chat. Yikes, I'm dropping stuff. Either way, I hope y'all have a great time, a great day, and a better tomorrow. And I'll see you in the next video. Bye.